And in inundated Thailand, the threat of the disease is rising with the waters. Aid workers say at least 2 people have died from a waterborne disease. Health officials have also noted a sharp rise in stomach illness and respiratory problems. With the water failing to drain away, the potential health implications are increasing. Tony Chang reports from Bangkok.
Thousands of volunteers gather in the corridors of a Bangkok shopping mall to help fight the floods. Their contribution to make EM, or effective microorganism balls. The science works like this. The microorganisms in the balls, when activated by the floodwater, will eat the pollutants and dangerous bacteria. They're hoping to collect more than 1 million.
The usage or the effectiveness of the EM ball is for them to solve or improve the polluted water, which is now the major problem, especially in Bangkok area at the moment.
Those dirty brown waters hold a myriad of dangers. And as they reach further into the capital city, they're picking up more waste as they go.
The problem with living in these flood-affected areas is that the water is frankly disgusting. It's full of raw sewage, which you can smell from the sulfurous odor in the air. The water's completely black. Even if you look down, you can't see 30 centimeters to the bottom of the road. And it's full of industrial waste. You can see oil slicks over the top. There's garbage floating around in it. And the government's telling us that for millions of people living in the flood-affected areas, these are going to be the conditions they're going to have to survive for over a month.
It is a great concern. Waterborne bacteria is leading to stomach upset, skin problems and respiratory disease. With hundreds of thousands of people choosing to remain in the flood-affected areas rather than evacuate, the situation is getting worse. And as the disaster spreads, the threat grows.
And right now the water continues to flow quite rapidly, and as a result it's a little bit safer, but in time the water is going to get more stagnant, and when it gets stagnant and stays still, then there's an increased problem of disease outbreaks there as well.
The earliest victims are the old and the young, these patients in a ward specially set up for flood-related illnesses. Although this hospital is itself surrounded by water, many of these people were evacuated from other areas harder hit. Outside, the pumps are keeping the hospital compound dry, but the constant threat of flooding is also having a dire effect on the health of those nearby.
Anxiety. It's anxiety because most population is concerned about their residence, their home, there's no place to stay. They change the activity of daily living.
And as the disaster continues to spread, so too the threat of epidemics. Communicable diseases such as cholera are the greatest danger, with the government saying these conditions could last for up to 6 weeks. The authorities are preparing for the worst. Tony Chang, CCTV, Jengwatana, Northern Bangkok.